And it gives me an opportunity to, what I not missing, okay, and what way, my portfolio can, kind of take it to the next level, okay. So in that way, this is really helping me to gain the knowledge and share the knowledge, share the best practices from whatever I follow to the rest of the world actually. So that is the transformation which AI is going to help. This is a positive. A negative, yes, any technology for that matter, it will have a positive. That's where the technology will become matured.
There's a lot of regulations and compliance in picture. That is why bringing in a new innovation or leveraging technology like AI becomes a little bit challenging. What are some of the gaps or challenges that you have observed when we talk about India's healthcare ecosystem today?
So I completely agree with you. I think this is becoming major hurdle.
Correct.
In fact, even in the developed countries. Okay. So in India, it's a long way. Okay. At least we don't have stringent, mechanism to, governments are allowing us to, do a POCs and all those things. So it is helping us to mature the technology. So the gaps, if for your question, one thing, in India, 90% of the healthcare data is not being captured.
Yes.
Whereas, if you see the clinical facility, urbanization has more 70 to 80%, whereas rural has got only 20 to 30. It's just other way.
Yes.
So there is a huge deficit of providing the facilities for rural villages.
Vanakkam Chennai, I am Simran Shiwalkar, your host for today, and we are witnessing the latest edition of Emerge Tech, the Multicity Roadshow, brought to you by the Mainstream. Today, I have with me Mr. Srinivasulu Thayam. He is the Chief Technology Officer at Arvind Eye Care System. Firstly, Srini, thank you so much for joining us today.
Thank you for having me here.
Hey,
Thanks for this opportunity. Yeah.
Well, can you tell us how today has been? Can you share the experience with us today?
I mean, it's an amazing. I mean, it's like a cross learning from each other and from each organization and each geographic area, each domain. It's absolutely see kind of what's happening in another part of the world, and really learning experience. And of course, the kind of sharing the products from the vendors and the stalls in upcoming technology solutions. And it gives me an opportunity to, what I not missing, okay, and what way, my portfolio can, kind of take it to the next level, okay. So in that way, this is really helping me to gain the knowledge and share the knowledge, share the best practices from whatever I follow to the rest of the world actually. So it is complementing each other. That's what I see actually.
Wonderful. Yeah. I think that's part of the mission as well. And I think if that's coming out really well, then we have kind of, achieved, made most of the mission. So, Srini, I am aware that you will also be, part of one of the panels on AI. Today, AI has become, an essential topic on every conversation. It's become a boardroom discussion, a part of every boardroom discussion. Can you tell us about how AI is kind of, helping organizations look at cybersecurity strategy in a very different way? It's an enabler as well, but what is your take on it?
Okay, let's put this as two ways of looking AI. One is benefits of AI.
Right.
So the AI today, it's a fortunate, particularly from the healthcare perspective.
Correct.
I would say there's going to be huge opportunity from the healthcare perspective, particularly, from Arvind Eye Hospital, So, and being a world's largest eye hospital, where we see 30,000 patients, through our platform every day.
Right.
And we are we do, almost 1 million surgeries in a year. So, I mean, when you handle huge volume, okay, and our focus is more on, kind of providing eye care affordable for needy people.
Right.
Okay. So in that way, AI is helping us to make it accessible for everyone and affordable for everyone. But of course, during this journey, you go through a lot of challenges. For that matter, any technology implementation, learning is kind of, again, from the AI perspective, it's a big learning. Okay. I mean, today, most of, the industry is talking about POCs, trial run. Fortunately, we've been operationalizing AI for the last 3-4 years.
Right.
Okay, so today our diabetic retinopathy AI model runs in 100 hospitals. Okay, and which helps to detect diabetic retinopathy by a non-clinical person within few seconds. Okay, otherwise earlier you need a diabetologist, you need ophthalmologist. It will take at least 4 to 6 hours to conclude. But today, take an image, upload, you will see the results.
Right.
So that is an advantage of AI. And I don't know if you have come across, recently Microsoft, did an assessment.
Yes.
They said
For healthcare
for a healthcare sector, they said if you invest $1, the returns will be $3.5.
Right.
So in a healthcare perspective, there's a huge opportunities in more than any other sector. And like a bank, today we don't go to bank.
Right. Right.
Because it is completely digitalized. So the AI will help same approach where the patient can be monitored remotely, where he or she doesn't need to come to hospital.
Right.
That is the scenario we're going to see. Okay, so that is the transformation which AI is going to help. This is a positive. Negative, yes, any technology for that matter, it will have a positive. That's where the technology will become matured. Okay, so same AI can enable hackers to impact in a big way.
Right.
Okay, so the same AI can fix this in a quicker approach. So you need to have a balanced approach. So my view is, particularly from the hospital operations perspective, you need to be prepared. You need to have a resilience architecture, assuming anytime you will have to go through this threat.
Right.
You need to ensure your data is protected. Most importantly, your hospital infrastructure is protected.
Correct.
So that you can have a seamless patient care, it can be provided.
Absolutely.
So, I mean, having few negative things with respect to, but you need to be prepared. That's the job of any CAO or CTO of any digital organization, actually. Yeah.
Wonderful. Again, taking cues from what you just said, you need to be prepared for any CIOs, CISOs, or CTOs who are leading this ecosystem today. You also brought in parallels from, finance perspective and healthcare, both of them having their own opportunities. But when we talk about finance and healthcare, one thing that I have observed in common is there's a lot of regulations and, compliance in picture. That is why bringing in a new innovation or leveraging technology like AI becomes a little bit challenging. What are some of the gaps or challenges that you have observed when we talk about India's healthcare ecosystem today?
So I completely agree with you. I think this is becoming major hurdle.
Correct.
In fact, even in the developed countries. Okay, so in India it's a long way. Okay, at least we don't have stringent mechanism to governments are allowing us to do a POCs and all those things. So it is helping us to mature the technology. So the gaps, if for your question, one thing in India, 90% of the healthcare data is not being captured. Major gap. So if you see, for fundamental reason is, so there's something called EMR, electronic medical records.
Right.
Okay, so there's something called hospital management system. So this hospital management system is only from operational perspective, billing, registration, inpatient, more from the logistics perspective. But it doesn't focus on the clinical investigation. Let's say a patient visits 50 times to the hospital. If you wanted to track the entire history, instead of going through the case sheets, let's say imagine you have the entire data. Okay, this data helps AI to build the intelligence When the next time patient comes, okay, I have this problem. So AA goes and checks the entire history, provides the recommendation.
Right.
That's what today in developed countries they have, because the governments are encouraging to use EMR, incentivizing healthcare providers to use EMR. So in India, if you see, I would say like maximum 10% or 15% of hospitals have EMRs. Okay, most of the hospital you would see hospital management system, not EMR.
Right.
So fortunately, Arvind, Eye Hospital, we built our own EMR almost a decade back. Okay, so since we built EMR, we were able to capture so much of data.
Right.
So that data is helping us to build the AI solutions today.
Absolutely.
Okay, rather building this solution using the synthetic data, something test data. Today we use the real data to build the solutions. So that's why we are able to implement the diabetic retinopathy in rural. It is operational for the last 2 years. So that is the fundamental gap I would see. I mean, rest of the things, complaints perspective, I think we are too far to that. The first thing is capturing the clinical data in a system. That should be done immediately.
So we are not, from an Indian, from an India perspective, we are not able to leverage the power of data real time.
Exactly.
To kind of, get the insights when it comes to file mapping for any patient.
Absolutely.
Yeah.
So today, in our hospital, if you see, we are building something called patient summarization.
Right.
AI. So, you see, doctors may not, every time the same doctor will not see the patient.
Correct.
There will be different doctors, right? But imagine if I have the entire data on my EMR, the doctor comes and patient reports, okay, my EMR provides the entire summary of the past visits.
Correct.
So that you'll get a complete view.
Yes.
And it recommends, okay, this patient is chronic to this disease and this medicine doesn't work for him, okay, and the whole summary is provided there actually.
Right.
So that is an advantage actually.
Wonderful. And I am aware that, organizations like yours, Arvind Eye Care Systems, we are kind of leveraging, more and more technological advancements like AI, data mapping as well. So any key practices or best recommendations for organizations to kind of, streamline data or adopting technology so that you are ahead of the curve in today's fast evolving landscape?
Yeah. One, as I mentioned, the EMR. That's a fundamental. Every hospital should have electronic medical records. One. The second is today, see, if you see typically, India population, okay, 60 to 70% is from the rural.
Right.
Only 30 to 40% are urbanized.
Yes.
Whereas, if you see the clinical facility, urbanization has more 70 to 80%, whereas rural has got only 20 to 30. It's just other way.
Yes.
So there is a huge deficit of providing the facilities for rural villages. So that's where, it helps, the telemedicine helps a lot. Okay. So in India, I think in the entire world, we started talking about telemedicine after COVID. Okay. But in our, our nation, we built this telemedicine early 2000. Okay, we built, at that time, we did not have a Wi-Fi in India. So what we did is students from Carnegie Mellon, they came and they built a VSAT from Madurai to Theni to provide the telemedicine. So today, we have 140 telemedicine centers, okay, where non-clinical person goes there, okay, brings the patient, comes, because we ensure that we set up this telemedicine center, for 50 villages in one place where they don't have a transportation facility. So the patient comes, takes the image and connects the patient to the doctor who is in a city-based hospital. And, go through the records through the EMR and provides the medicine and patient goes out.
Right.
So patient doesn't need to come to, city for getting the medication.
Right.
So this is really required in countries like in India. So EMR, the telemedicine, then the data intelligence. So for that, we need to have again the data,
Correct.
quality data.
Right.
Okay. Then build the data intelligence. And then today there are a lot of wearable devices. Okay. For example, your BP, interestingly, one of, a known person, what he does, there's something called a Save Mom. Okay. So, in the rural villages, because they may not be able to go to, hospital, what he did, he built an IoT based device, okay, and this will be monitored every day. If the parameters are not kind of abnormal, these readings are connected to the collector office.
Okay.
So all the pregnant ladies and around that, any abnormal, that it will be synced to the collector office. Then doctor will be informed actually.
Like a centralized.
Centralized.
Okay.
So this is the power of the IoT devices and all those things actually. So they don't need to travel, and someone can go to them. So that is the power of these wearable devices and IoT devices. Okay, how we can use that actually.
Right.
Okay, so one is an EMR, another one is the data intelligence and the telemedicine, and then this wearable, how we can make use of this wearable devices.
Yes.
So these are all the key elements for digital transformation in healthcare.
Absolutely. I think we have seen that shift post lockdown as well. The increase in wearable devices.
Yes, exactly.
I personally started using it, to be a little more, cautious. So I think with so much happening in a technology space, healthcare space, and then there is an intersection of how do you think platforms like Emerge Tech, how do you think these conferences kind of build a platform for conversations around AI, tech, from varied segments of, we have industry leaders. How do you view these platforms?
It's learning the best practice from others. Okay, if someone does interesting stuff, it's not that BFSI practices will not work in healthcare. Nothing like that.
Right.
Okay, so what I share something best practice, this can be implemented. So this sharing of the knowledge will really help. Okay, that's one thing. And for example, I was going through the stalls. I realized, they were kind of explaining about building models, through Azure platform. So they said, they'll be able to do everything, it's only we need to pay the service the cost for the services. So these are all the opportunities where we will come to know, okay. So of course the networking. So sharing the knowledge, that's the one thing. And also to assess where we are standing, comparing with other organizations. So that's the way it's really helping, and it's like building the community. Yeah.
Absolutely. I think that's the core purpose of building that community and, kind of having that exchange of dialogue.
Yes. Yeah.
But thank you so much, Srini, for sharing your insights and being so candid in this conversation.
Sure. Yeah.
Well, while we wrap up, I most certainly look forward to connecting.
Sure. Thanks for giving this opportunity.
Thank you.
Nice talking to you.
Thank you.
Yeah. Thank you.